But first, I want to deal with this issue of beds because Kapil Chopra, you've been working on this for a long time. What's the feedback that you get, especially in Delhi?
So we really realized there was a case in the Supreme Court, and I was just glancing through. My father used to be a doctor. We used to run a small charitable clinic affecting just 25-30 people. We saw this case by Ashok Agarwal, in which the private hospitals were directed to provide medical care to people. We just thought there was a great opportunity. I come from the private sector, personally running a hotel company, and I realized that a poor person, your maid, your driver, could not walk up in the fancy lobby of a great hospital and say that I need my bed. We just thought we will take care of that divide between the private sector and EWS and try and get people into healthcare. And that's what we really started with. When we started, so just to give you an idea, 650 hospital beds every day. Across 47 hospitals. That number keeps on changing, but I'm just giving you a ballpark idea. Every day, around 2 years back, 200 beds were occupied, 450 beds were vacant because it was very difficult, there was too much paperwork. To the credit of the government really, and to the credit of some officials in the Delhi government like Dr. Das, who really runs this program, they were really forthcoming. And when we met and met them, they said they were really happy to have somebody from the private sector come in and really deal. Today, the situation as it stands, 400 beds occupied. But 250 beds in great private hospitals still go vacant every day. And I think the reason they go vacant is basically a lack of awareness. Just look at the prominent locations that hospitals are in Delhi in terms of the government hospitals. All we need to do is put up big hoardings, tell people decongest the government hospitals and move to the private hospitals. Every day, two of my people, and they're here in the audience today, from 7 a.m. in the morning till midnight, that's what they do. They reach out to people, and everybody who's actually listening to this program, just give us a call. We've got 2 numbers on our website. Just give us a call. We'll take care of everything. All we need to know is there is a patient and we will try and get him to the private hospital. We'll get the entire paperwork. We take away the friction that a poor person faces when he goes for a hospital bed actually. Today the situation is much better. But there are hospitals who've actually gone to the judiciary which actually empowered this entire act and actually have taken a stay order. Apollo hospitals, BL Kapoor is a classic example of hospitals who got to stay through the judiciary and not fulfilling this duty. And I'm surprised, why doesn't the court really ask them, did you get land at concessional prices? And there are hospitals like Sir Gangaram, Max Balaji in Patparganj, Fortis Escorts in Okla, who are really doing a stellar job and trying to help everybody who really
Many
comes
of these hospitals have got land at concessional rates and are not following the EWS norms.
Yes.
And that is the problem. I'll get
care only. If you
Kapil,
go any other
come in on
So
that.
I really want to say, I think we're looking at this in a very intrinsically wrong way. I think the first thing is the government also announced mohalla clinics. So everybody nowadays, what they do is they rebrand the old property and bring it up in a new bottle. So if primary healthcare centers, there are 650 small clinics in Delhi run by the government in any capacity. If those 650 primary healthcare centers could have been activated before dengue happened, that is the right step the Delhi government could have taken. The right step the Delhi government could have taken for dengue prevention is higher levels of fumigation, not letting the water accumulate. You go to Mahipalpur. I drop my 11-year-old daughter to Vasant Valley School every single day in the morning, and I walk Drisika through the Mahipalpur area. It's a breeding site. So forget about people's homes. Why? I think the honorable minister is making a very valid point on people's homes, but it's happening on the roads. Just look at the puddles. If it rains, this dengue outbreak, just trust me, thank God it's not raining. If it rains, it will even go to a worse situation. And this thing is going to be repeated again. Ma'am, somebody is going to die on the road in the chilly winters of Delhi in December and January when people are reporting that there are no waiting places outside AIIMS and Safdarjung. Let's take a round at 1 o'clock tonight and you will see there'll be 200 people sleeping on the roads. Is the Delhi government or any government or the central government or anybody who's in power, I think what people need to do is need to have a passion to serve. And I think that is what is lacking across the political spectrum in this country. I think that is the problem. So that is why people in the private sector like me who have a day job have to look at a night job and say, we have to work on this. And honestly, beds are not covered. This Apollo is a separate thing. Apollo doesn't even take any patient. Now imagine I'm saying I'm going to give you a bed free and going to charge you, like the lady said, 200 rupees for a crocine. Means how ridiculous can that be and how can we even justify it? Means, and I think that's the problem. The problem is there is a passion to serve.